The plans to procure the antiviral COVID-19 pills were first announced by the Minister of Health, Dr. Frank Anthony, during his daily COVID-19 update on Monday.
We're looking at the pills. Both there are two pills right now that have recently been spoken about. Paxlovid, which is a pill produced by Pfizer.
According to medical experts, antiviral drugs are designed to prevent serious illness in someone who has developed COVID-19. However, the drugs should not be considered a replacement for COVID-19 vaccines, which are designed to stop the replication of the coronavirus as soon as it enters the body. So far in clinical trials, Merck's antiviral molnupiravir, which is being developed in collaboration with Ridgeback Biotherapeutics, reduced rates of COVID-19 hospitalizations and deaths by roughly 50%, while Pfizer's antiviral pill Paxlovid reduced COVID-19 hospitalization and death by 89%. Against this backdrop, and while the cost to procure these pills are unknown, Dr. Ramsammy is of the expectation that the COVID-19 antiviral pills will be as costly, much like the COVID-19 vaccines. However, he contends that when it comes to effectively responding to the COVID-19 pandemic, the cost of any medication is not a matter of concern for the government.
They are costly, but the Guyana government has made that commitment that if we could get it, we will pay for it. So we could have a more comprehensive response.
The biggest challenge in acquiring the COVID-19 vaccines has always been access, since developed countries were found to be hoarding the vaccines, thus barring developing nations from acquiring the doses that they need. As such, Dr. Ramsammy believes that, like the vaccines, there will be some form of inequity in the acquisition and the distribution of the antiviral pills. The real issue and concern will be in the area of accessibility and not so much the affordability of the product.
Our problem has not been whether we can afford the medicine. We saw it as a short-term expenditure that we must make, that we don't have an option, that it's a matter of life and death, and therefore we will worry about the expenditure tomorrow, but that we have to make the expenditure today.
Over the past weeks, Guyana has recorded a decline in new COVID-19 infections, hospitalizations, and deaths, a phenomenon the health minister continues to attribute to high vaccine uptake. It is therefore believed that these pills will help to further reduce the country's hospitalization rate. For the HDP 90 News, Kendell Richmond.